All right, so today I wanted to hop on and talk about Lyme and co-infections. So I'm a member of ILADS, which is the International Lyme and Associated Disease Society. So the way we treat these Lyme and co-infections is a comprehensive approach, right? So it starts with the discovery session. So with that process, I send you intake paperwork. We get the full story. We sit down at your first appointment, which is 90 minutes, and we go through everything. Before we start treating Lyme and co-infections, we have to address all the systems of the body, right? So we have to start with, are you getting enough sleep? What's your diet like? Are you getting enough movement, exercise? How are your stress levels? How are your relationships? How is that mental, emotional, spiritual? So there's a lot of foundational things that we have to get in place. Most people that are dealing with tick-borne disease, such as Lyme, co-infections, or Bartonella, Babesia, tick-borne relapsing fever, Ehrlichia, those types of things, they have a chronic inflammatory load in their body. So I like to think of inflammation like a cup overflowing, right? So what's causing all of these symptoms? Typically, people with Lyme and co-infections, they have systems all throughout their bodies. They'll have like mental health problems, visual disturbances, sometimes ringing in the ears, swelling in their lymph nodes, palpitations or POTS, funny heartbeats, cardiovascular issues. They may have joint pain, muscle aches, belly problems, problems with their legs, cramps, rib pain, a lot of non-specific symptoms, but typically it will be all throughout the body, right? So, like I said, it goes back to that chronic inflammation. The cup's overflowing. So, what's causing that cup to overflow in this situation is a lot of things. So, it's probably your genetics, your diet, your sleep, your stress, maybe mold, maybe Bartonella, maybe a co-infection, and then your cup's overflowing and you're manifesting all these symptoms all throughout your body. So, like I said, my approach is not just to kill the infection. My approach is to get the full story, work on those foundational things, the sleep, the stress, the diet, the exercise, the relationships, and then do some testing. I like IGeneX testing. They use a newer methodology. It's called a FISH, which is fluorescent in situ hybridization. We basically get a blood sample, and then the lab sticks a probe into your blood, and if the microbes are there, it will light up. It actually looks really cool under a microscope. So we get the history. If you have all these systemic symptoms, and I'm thinking tick-borne disease, we're going to do this IGeneX testing. If it's positive, we're going to work on these foundational things. And then before we start killing the microbes, we're going to work on opening your body's natural detox pathways, which is primarily your liver, your kidneys, your lymphatic systems, and your gut, right? So some herbs I like to use are dandelion. So personally, I have Bartonella, which can cause a lot of these symptoms that are body wide. So every day, this is my regimen. I take a couple drops of dandelion. Dandelion is used to open up the liver and help bile flow. I'm also using some bromelain. These are capsules that help break up biofilms, along with serapeptase. This is another biofilm buster. These chronic infections tend to aggregate and cause biofilms, so it's key to break up these biofilms. What happened to me with this serapeptase is that because I think I have a high load of biofilms and I had a positive IGeneX Bartonella test, when I started breaking up these biofilms, I started having a die-off reaction, also called a Hertz or a Herxheimer reaction. So what's used in that case is berberpanella. It's a herb that helps with the die-off reaction. So I take a scoop or a full dose of that every single day. And then, so I started with these herbs to kind of open up my detox pathways while I'm working on the lifestyle, the sleep, the stress, the diet, the exercise, the mental, emotional, spiritual. I've worked on my gut. I've cleaned up my gut health. I'm on the right probiotics. I figured that out through a comprehensive stool test that looked at my microbiome. So once I have all of that in place, will start adding the killing herbs. So I started with this Nutri BRT, which has got a bunch of different herbs in it. It's got like Japanese knotweed, cryptolepis, a bunch of different herbs. And you want to do this very slowly. So I'm only taking 1, 2, 3, 4, 5 drops a day. And I could definitely tell when that happens, or when I take that, I get a Hertz reaction. So anytime you get a Hertz reaction, you simply take more Bartonella. So this is usually like a 3 to 6 month process of killing these tick-borne infections. But to do it correctly, you have to take a comprehensive approach. Look at those baseline things, the lifestyle stuff. Take a look at your gut health, your hormones, your detoxification systems. Get all of that in place, and then you want to start killing the herbs. You've got to have your detox system in place before you do that. So if you like what you heard, give me a comment, ask me a question. I'd love to meet you, get you some testing done for these tick-borne illnesses, and get you feeling better. Thank y'all.